Hi, I'm Catherine Ayers-Wickenhauser, Director of Communications at Direct Trust. And today I'm so excited to be joined by Dan Wilson from Moxie Health, who has recently been named one of our interoperability heroes. So hi, Dan, welcome. Will you please introduce yourself and Moxie?
Hey, Catherine. Great to be with you today. I appreciate the opportunity. So, by way of introduction, I am Dan Wilson. Been working in healthcare for the last 15 or so years, based here in Wisconsin. So, I'm in the Madison area. Originally got started in healthcare, working actually within the employer wellness kind of segment, and then ended up going out and working at Epic. Spent a number of years implementing medical records with health systems around the country prior to founding Moxie. And so Moxie is focused on data interoperability, but very much focused on really more the non-treatment side of interoperability. So a lot of the payment and operations use cases. And so as a result, we end up very frequently sitting between health systems, insurance companies, other vendors engaged in kind of the payment and operations space, and look at how we can use clinical data exchange to really make the operating side of healthcare as efficient as possible. And the objective is certainly, how do we make healthcare more affordable, more available to people, and how do we use then technology and all the infrastructure that has been built up over the last 25, 30 years around digitizing data. How do we use all that infrastructure to now really unlock as much value for society as possible?
And I think you're touching on different points within health IT and interoperability as a whole. So frequently in the interoperability space, like you just touched on, we are discussing connecting those providers of care, but certainly there are so many other pieces to healthcare that impact the patient experience and impact quality and affordability, like you outlined. And I'm curious, just because there's been so many conversations about advancing interoperability and thinking about what's next. Part of the industry has this sentiment that we have what we need for the advancements of interoperability. It's here, kind of, we have these tools and we need to put these tools that we have into action and further use them. But you're describing a different perspective. You're coming to this side and maybe this conversation with a different perspective from the treatment side to the payment and operations side. So I'm curious if you share that same view or if you think something different.
I think I candidly feel a little different. Certainly believe we've made a lot of progress in the last 20, 25 years around interoperability. I've not worked in the space that long, but I still remember RIOs and HIEs certainly. And so there have been, these multiple waves of effort to address interoperability. A lot of people, kind of use the flag of no more faxes as kind of one to plant in the ground. And, obviously we still have a huge amount of faxing taking place. There's still e-fax companies that are popping up, getting funded, and, which would imply that people believe there's a lot of opportunity still to be doing e-fax long into the future. So I think we have made a lot of progress. I do think that there is a fair amount of, improvement and growth opportunity ahead. And really, I think it comes from my point of view, which is that interoperability isn't a thing. It isn't even like a point in time that we will have arrived at. It is a philosophy. And we are all allowed to have a slightly different interpretation of what interoperability means. Historically, we've kind of taken a very technology-centric view, and we kind of all organized around this notion that interoperability was, how do we connect databases to move, semantic information back and forth? And you have your kind of, let's go syntactic to semantic in our interoperability. And that was kind of, now we know we've arrived because we have, semantic interoperability, which I would argue we don't have. But there are other people that are coming at the interoperability discussion from very different points of view than technology. So a payer, for instance, who we work with frequently, when they think about interoperability, it isn't at that technical level. It's, I need a medical record. I need to understand what was done during an encounter, perhaps to adjudicate a payment or to determine a prior auth, decision. When you look at a patient around interoperability, they're not thinking about technology either. They're thinking about, why do I have to fill out those forms again? Why doesn't this doctor understand my medication history? So we all come at this from a slightly different point of view, and we're looking for something different out of the kind of interoperability experience. And so where I think we are today is that we have invested and built a lot of the core tooling that is required. And now it is time to take those tools and start to organize ourselves around different problems we're trying to solve. And in focusing on specific problems, we're going to be able to make significant progress. And that's really where I see this kind of next wave, where 5-10 years ago, it was so hard to get data out of systems that the quote unquote problem to solve was get data out of system. Now that it is getting easier to get data out of systems, we get to think about the next level of problems to solve. And that should be ongoing, continuously evolving, getting deeper and deeper and deeper kind of model, which is why I say, I don't think that there's like a destination we're going to get to where we say, great, job is done. We will just uncover the next problem set that we want to try and solve.
Sure. And, you touched on the dreaded clipboard, right? You show up at a provider's office, you fill out that information again on a piece of paper most often, and wondering, why do I have to do this in this way? And you certainly outlined kind of the history of where we've been and uncovering a little bit about what we need to do in the future. But I'm curious, maybe if you could tell us a little bit more. So you talked about our journey up until this point, but from your perspective, what is next? What's the next challenge that we really dig into?
Again, this comes back to like, where do you sit and what are you most focused on? And there could be a lot of very good answers to that question. From where I sit and the problems that I'm working on, which again are really more in this, primarily in the payment and operations space, privacy and incorporating more privacy-centric principles into data exchange is key. And if you think about what has held a lot of the non-treatment data exchange back historically, a lot of it is that you're asking a health system or provider who is a steward of their patient's data to say, share this information with somebody else outside of your environment, with whom you may in fact have an adversarial relationship with. So like the payer example, share more data with the payer. And that triggers all of the concern that the payer is going to use that data to either, pay less, somehow going to be used against the provider the next contracting period, that the payer may have some other kind of bad intent. And, in order to make progress against that problem set, we've had to really think about, what does minimum necessary data exchange look like? How can you enable the requisite data to be exchanged with this external group, but err on the side of not oversharing? And that starts to really dig into access control and principles around privacy. So if a patient does not want their data shared, or a patient only wants it shared in certain circumstances, those are concepts that I think as patients, as people, we're all very familiar with. Mm-hmm. But from a interoperability as a technology perspective, we don't often talk about those principles when we talk about how to engage in more data exchange. And so what we are focused on, and what I think is going to be a continual focus for a lot of people over the next number of years, is how do we get more specific with understanding the content of the data we're looking to move around, the purpose of use for that data, and then from a technology perspective, how do we maintain accordance with kind of business preferences, patient preferences, and legal requirements to say what data can and cannot be shared in a variety of different circumstances. And so, I think there are a lot of people working on other areas within the interoperability space, but that is the area that we are primarily focused.
Sure. And you brought up something. So just that concern of the data sharing and what you are obligated to do versus what you might get in trouble for. My good friend, John Lynn, he calls it hypanoia. So just that paranoia of accidentally oversharing something. And that's certainly in this day and age, something that I think we're battling against is maybe a misunderstanding of HIPAA or when it is appropriate to share information. And you outlined a slew of other situations in which there might be other concerns at play. And I certainly agree with you that this is an important area that interoperability has to dig into and get better at. And part of what I just took away from your comments was that this also can't be, I think we often kind of look at HIPAA as not one size fits all, but it's definitely a framework in which we look at certain things. But I'm taking away from your comments that we need to look at this a little bit more, not as a one size fits all solution, and make sure that we're meeting the needs of who needs the information shared for their best possible care. And so I'm curious on your take on that.
Yeah, I mean, I think it's entirely an N of one kind of situation. Certainly there's a framework and there are hard rules at play. So I don't mean to imply otherwise, but if you think about HIPAA with a patient consent, with an individual consent, anything can be shared with anyone for any reason in any form. And so, certainly with cures, we're getting, and some of the evolution in HIPAA, we're starting to embrace that a bit more. But even still today, it is not uncommon to find an organization who says, I can't email you your record because of HIPAA. And, there's the Twitter account, bad HIPAA takes. Like, yep. I mean, it happens every day. And it's because it's complex and people know, the stewards of data, in many cases, the HIM departments of these institutions feel real ownership over protecting the patient. I really do think it is coming from the right place. And it's just that it's very complex and there's a lot of room for misinterpretation and there's a lot of need to educate further. But, the reality is HIPAA is intended to protect the individual and their sense of how they want their data used. Not, it's not like a global concept because every individual has a different interpretation of what is or is not sensitive to them. And so that's a level of nuance. It's very, very challenging to actually solve at scale. And I think the task at hand is how do we just make continual progress towards that? How do we get better and better and better at understanding how an individual views their health data and wants it to be or not to be used, ideally for their benefit? And then how can we as technologists support that? And so there are a number of efforts going on. There are a lot of people, I think, that are working on this, which is great because it's going to need to be really an ecosystem kind of driven approach. But, AHIMA, which is a national association focused on record management and HIM professionals, is getting increasingly involved in the interoperability space and looking at privacy-centric exchange. And we were fortunate to partner with them last year and this year on rolling out what's called the HIMA D-Health, which is really a program to help applications looking to leverage cures to be able to better serve their users. They're getting patient data into those tools to help them understand various privacy considerations and make sure they're incorporating them into their tool set. So I know, the entire HIMA organization is very focused on how do they educate their membership on a lot of these kind of topics, and how do we bring more privacy-centric discussion into the interoperability space. You also have there's a consortium right now that's been formed over the last couple of years. I believe there's upwards of 200 people involved today, which is the Protecting Privacy to Promote Interoperability Work Group. I'm involved with that, but there's a large number of people all focused on how do we recognize that an individual and their desire around sharing or restriction of sharing of their data, how do we as an industry get better and better at kind of honoring their preferences? And so the idea is that today, when an individual needs to do that one size fits all or none buy-in or not bought into the system here, that the people who are most disadvantaged and most, I guess, not necessarily like factored into a lot of the decision making today are the ones who are going to opt out. So we will, as we're talking about all these kind of larger themes of, data and machine learning and bias in models and things that are very weighty topics, we need every disadvantaged individual to opt in some form to having data shared so that those models can be built and trained in ways that don't continue to, promulgate bias. But in order to get to that point, we need to give people some control over how their data is shared. And so, the PP2PI group is really focused on that. And through that work, it's been really interesting to see all the different organizations around the country that we're starting to learn and meet with that have been working on a lot of these, topics for a number of years. So again, has to be an industry-wide or, ecosystem-driven approach. But I am hopeful that we will make real progress over this next, handful of years in getting better at giving patients control of their data, but in a way where we're not saying, we're going to treat this as a purely opt-in model, which is what has happened in the past. We've seen that an opt-in model is very challenging to scale. And so how do we find this right balance between opt-in, opt-out, and granular opt-out that specific individuals can, kind of sign up for?
Sure. So, and it certainly sounds like that the work of these groups, like AHIMA, like the work group that you mentioned, that they're digging in and certainly paving the path to move forward. And I think what we find continually in these conversations and others is that the collective group coming together, like you've outlined, working on this problem, that really is what advances interoperability. And with so many challenges to solve, getting those people to the table and then finding solutions is certainly important. So I thank you, Dan, for outlining all of that today. And I am curious, as we wrap up today's conversation, if you have any final thoughts or words of wisdom or anything else you'd like to share.
I think it's a really exciting time in this space. I've been working in health IT, as I mentioned, for 15 or so years. And each year I feel like it's getting more exciting than the year prior. And, true to form, I feel the same heading into next year. So there are a lot of very dynamic things happening in the space. Not, as it relates to interoperability, there are no shortage of problems to solve. We certainly need to find ways to continue to build more bridges and work together on a lot of these problems because they fundamentally cannot be solved by one private company. I'm excited about the what is ahead. I'm very optimistic about the progress that we're going to continue to see made. And I very much appreciate all the work that others have put into getting to a point where we are able to make some of these fairly significant leaps around using clinical data to really improve outcomes for real people.
Mm-hmm. Yeah, very well said. So, Dan, congratulations again on being recognized as an interoperability hero. And to watch more interviews like this or learn more about the Interoperability Hero Initiative, check out the Interop Hero section on the Direct Trust website.
Thanks, Catherine. Have a wonderful day.
Thanks, Dan.